Hey there guys, it's Dr. George here, and today is day one, and I just wanted to report on my third session for the day, which was an interesting study which looked at two main areas. The first one was the connection between HPV and anal cancers, and the other part of this session was really concentrating on the syphilis outbreak in northern Australia. So let's dig into the HPV stuff first. So this was primarily a variety of different information that was provided by the people at the Kirby Institute and the SPANK study. And so what we already know is that there is an association between HPV, in particular HPV-16, and the development of head and neck cancers, anal cancers, and cervical cancers. And the first talk was looking at the connection between HPV vaccination and the older men who have sex with men group, because it's, currently the recommendations are that beyond the age of 26 it's not worth vaccinating against HPV because this age group has probably already been infected with one of the forms of the virus. So we know that 90% of anal cancers are associated with HPV, and 92% of those anal cancers are associated with HPV-16. Men who have sex with men are at a 40-fold risk of developing anal cancers, and if you're HIV positive and a man who has sex with men, it's between 50 and 100 times fold risk. So if we can be vaccinating people against, in particular, the HPV-16, then that will make a really big difference. So in the study, they looked at older men who have sex with men, and basically what they're finding was that only about 30% of this population had actually been exposed to HPV-16. And 1 in 5 had been infected with one of the 9 different forms of the HPV virus that could be covered in a combivalent vaccine. So this would indicate that these people are actually naive to the HPV vaccine, which could mean they could benefit from this. In particular, given how nasty anal cancers can get, this would be a really fantastic thing to consider vaccination in this group of this population. So there is good evidence that the use of a HPV vaccine, in particular the 9-valent, is worthy of a trial in people beyond the age of 26. Moving on forward, they looked at the population of people who had pre-malignant changes to the anal mucosa associated with HPV, and what they've found is that a good portion of these, about 50%, will regress after 1 year. However, again, HPV-16 is associated with higher grade lesions, and also the HPV-16 associated changes are less likely to regress as well. So HPV-16 infection is associated with a higher risk. Again, HIV positive men, men who have sex with men, that is all associated with that. They're wondering about the older population. Is this, why is older people at a higher risk? And it would appear that these are guys who are actually a little bit more sexually adventurous and having sex with more people. And so they continued on to look at, are there particular markers associated with the HPV anal cancers, in particular genotype, HPV viral load, and RNA mutations. The main associations are HPV-16, and in particular E6, E7 alleles, and the key 67 biomarkers are associated with anal cancers that are likely to persist, and also higher viral loads of the HPV virus is also associated with an increased risk as well. So bottom line for me is that we should probably be reviewing our HIV positive patients for anal cancers. They are at a significantly higher risk, and we should really be considering about the vaccination of this population as well. The session then went on and really looked at from a number of different angles on the syphilis outbreak in Northern Australia. So basically, since 2011, there has been a spike in syphilis within Queensland, Northern Territory and the Kimberley regions. It started in Queensland in 2011 and really peaked up in 2014. So there's been quite a robust public health response, and this has included testing of syphilis in all women of reproductive age, and also very intensive syphilis testing during pregnancy, with up to five tests for syphilis during pregnancy. And if somebody does have an intra-pregnancy detection of syphilis, they get that treated, and also monthly syphilis screening as well after that in cases of reinfection or incomplete or non-responsive treatment. There have been a number of cases of congenital syphilis, and it was reported that there were 8 cases of congenital syphilis. 4 of those babies did not survive, and the other reports are there's one definite case where the child was born with blisters on the palms, blisters on the soles of the feet, and with treatment has done exceptionally well. And there are 2 other babies who were born to mothers who tested positive for syphilis at birth. And these children also had titers but no other signs of syphilis, but with treatment the titers went back down and they're living normal lives as well. But it's actually been quite challenging, and what has been very interesting is just looking at quite a very robust response from a number of different health groups that have come together to really work towards tackling syphilis within the Indigenous population in Northern Australia. We then went on and had another look at the rates of other STIs within Northern Australia, and it was interesting to see that there are much higher rates of STIs within Northern Australia. Chlamydia is 3 times the risk, gonorrhea is 18 times the risk, and syphilis is 4 times the risk. And there was a look at trichomonas and other as well. Interestingly, gonorrhea is more in men than in females. Chlamydia was more in females than men. But very high rates of STIs within the within Northern Australia, and sort of certainly outside of the proportions of within the non-Indigenous population of Australia. And so these are areas that are currently being tackled. But it was a really interesting afternoon session where it's quite obvious that sexual health is going to be a very important issue. And to go on from the opening talk, I think it's important that we try and do our best to unpack sexual health in regards to our Indigenous community. How can we best provide the services for this community? And it's about frequent ensuring that the health sector is working well within the community, but also how can we best provide information that's useful, helpful and digestible by the community as well. Really interesting session, and there's a number of resources that are available at the website for the conference, and I can put links to that here. Anyway, I'll keep on moving on.